Heart is anterior side, posterior side, right? See this T right here? There's this fat T here. It's not too late. There's this fat T here. That's the posterior side. Okay? This is the anterior side of the heart. And then you can see all the adipose tissue, right? All the muscle that you see is epicardium. Okay? So epicardium. So we're going to cut, I'm going to cut two of these, starting at the apex, going to the base points, but we're not cutting a bagel. We're not going to cut it straight through. We're going to leave them attached so we can spare the base points, just like in a heart transplant. Usually they spare all the business up here when they can, and they replace the bottom part. Okay?
Question: how do you would you say, how do you distinguish the front from the back?
Well, there's in the back there's this the coronary sinus is buried under here, and also there are coronary arteries that come down, and it's generally it looks like a T of adipose tissue. So that's the posterior.
That's the posterior.
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 And then the anterior has it kind of looks like a pitchfork, but on an oblique angle. You see, it's kind of strange there. How this is the anterior, but everything's on an angle that way. Well, they're straight up and down when you angle the heart the way it sits in your thoracic cavity. So they're kind of up and down. So regionally, remember the bottom of the heart is the apex. The top of the heart is the base of the heart. Let's cut open. So that's that for now. We don't have a pericardial sac here. In your cat, you will have a pericardial sac. So some safety. Don't point to, anything. Only my hands are in here, right? Even if you have gloves on, don't point to things when I'm cutting. No stabbing each other. Okay. I have goggles if you so desire. Glasses are fine. But if you have contacts, just don't be blasé about it, because if this fluid gets underneath your contact, it could burn worse than just having it fleck into your eye. Never cut into your hand. Never cut over your finger. No sawing action. Try to keep it always in the tissue, and try not to cut any vessels. And we could spend a week reflecting all this adipose tissue, but we're not. We're going to make a cut. We're going to cut anterior and posterior divisions straight down.
And the anterior is covered with the adipose?
Yeah, the adipose tissue is all this white grayish material, and we're going to just go right through.
And the posterior looks like the T.
Yep, and the rear. Yep. I think with the heart, what you want to do right away is orient yourself, okay? So right away you want to look for the cut off further. You notice how I'm always cutting away from my hands. So this is what it will look like from the inside, okay? And the left and the right side of the heart, because you have to remember whichever way you're looking at it, you have to know lefts and rights. So if you just flip it around, the first thing you want to look for is thick myocardium on the outside wall. So thick myocardium on the outside wall. Directly adjacent to that is the left side of the heart. Okay, just like our heart box on the board last week. The smaller side of the heart has a thinner myocardium. Okay, this one is all misshapen, but this is actually a good right ventricle because it has a intact moderator band. That would be the moderator band right there. Okay, that's in the right ventricle. Okay, moderator
You
band.
have to know that one?
Yeah. You're on the vessel sheet.
sorry.
Go on to the other heart structure and add it.
Yeah, 'cause I didn't see it here, yeah.
Moderator. Because usually, the human heart, it's hard to find the moderator band, but add that
So
moderator
that would be
band.
under internal anatomy.
Yeah, internal anatomy. Hey, let's go in order here. We don't have the fibrous pericardium here.
Right.
External,
What?
we don't have the pericardium. It's not here. The parts of it are remnants of the pericardium are up here. Apex we already went over. Auricles are these little ears here. See the ears? There's one here, and there's one here. Those are the auricles, okay? I know the coronary sulcus is crossed out, didn't want it to be. Coronary sulcus is the depression where this coronary sinus and the coronary vessels are. So sulcus runs all the way around. So it's the coronary
So you
sulcus.
want it back
So
on.
you want
Yeah.
us to know that?
Yeah, that's the sulcus where the right and left coronary arteries come out. Interventricular sulcus is the depression where the interventricular artery comes down. So the artery sits in the sulcus, and then the adipose tissue covers the artery and the vein and over the sulcus, so it looks even higher. But actually, there's a little depression in there on the anterior side. So why is it interventricular? Because it's in between the ventricles. It's on the anterior side. There's also an interventricular on the posterior side, but it's not well defined, and it's not as filled with adipose tissue, nor is it readily depressed. So we're going to stick to the anterior side. We already know the ventricles. This is the right side of the heart, so right, this is the anterior. This is the right ventricle. Left ventricle would be down here, internal. Those are more internal structures, right? So this would be left, that's right, and this is right, and those are all ventricles. Aortic arch, that's when we get with these, it's kind of going to look like someone with a bunch of curlers in, but this right here is the aortic arch, okay? And we're going to go over what these other, we're going through the brachiocephalic, so really this is the brachiocephalic of the aortic arch. Left common carotid. Now, if you go into the tutorial lab, they'll tell you that the left common carotid comes off of this brachiocephalic much higher. It gets cut off, and that's accurate. It's the next one that you may get some inaccurate advice, because this technically is not the subclavian. It's often called the subclavian, but this is just a continuation of the aortic arch. The next major branch that comes up superior is about a ½ inch further, and it's cut off because it's easy to cut there when they're dissecting these out of the sheep. So I don't test you on the left subclavian artery on the sheep heart for that reason. This, if my probe is in this hole right here, I'm looking for the aortic arch, okay?
You're not going to test on the...
Only on the plastic for the subclavian.
Okay, what about the carotid?
Left common carotid is going to be basically on the plastic too, because the sheep heart only has 2 branches off of the aorta. You know, like 70% of the time. Some sheep have 3 branches, but most sheep don't. So that's the differences between, for the humans, know that there's 3 branches off the aorta, and they go in order: brachiocephalic, left common carotid, then left subclavian. superior and inferior vena cava. You have to come in the back here and wiggle through. Now, see, I'm using the handle. If you use this, I mean, you could stab through all of this, right, and make your own hole and say, hey, that's what it is. But if you use the handle and you wiggle your way through, you do less damage. And see, I get this through here. And now we have superior and inferior vena cava. And really, it sits like this. That's superior and that's inferior. When it's all together, and that's how it is. So superior and inferior.
Can you show me posterior?
So posterior is superior and inferior.
Thank you.
And it sits like that. Okay. Generally, when you see something on the posterior and you see the handle and the pointer part of the probe like that, I may ask you that. I may ask you that. I may ask you both. But that's on the base. It's superior vena cava. Towards the apex, it's the inferior vena cava. Those are 2 of the 3 holes for the right atrium. So next we have the pulmonary trunk. Pulmonary trunk is one of the easier ones. So you got to get the anterior side of the heart, and it's at a 45-degree angle, or an oblique angle. It's right there. So bam, bam. So that's in the front. That's the pulmonary trunk. And the pulmonary trunk then goes behind the aortic arch and then branches to the pulmonary arteries. All right? Arteries away. You take the coronary, put it to the side, arteries away. Don't go by color. So pulmonary will trick you. So we went over pulmonary arteries. The pulmonary veins come back, right? They're richly oxygenated, and it's the biggest hole in the posterior of the heart, and you can stick your thumb through it right there. That's the opening for the pulmonary veins. They're coming back from the lungs, and they're richly oxygenated.
There's 2 of them.
Well, actually, yeah, this is a meeting of 4. There's anywhere from 4 technically. Any less than, there's 3 to 6 basically. Average on 4, 2 from every lung. So, and they all meet, and it makes a huge hole in the back. So this might be a portion of one.
Right.
Oh, we broke it. Sorry.
That's what I was asking.
Yeah.
Typically, so.
And then there's some. That's a lot of adipose tissue right there. So generally,